Hello there.
Hello there, Janet Reeve here with Med7.
Hi, it's Dr. DeSilva.
Hi, I just thought I would log in and get on here first, just making sure we were all good.
Okay.
So thank you for doing this. This will be fun. Okay, I guess some more people are joining, so I'll hush.
Just let me know what to do and when to get started and how to share my screen and all that good stuff.
Okay, I think Austin's trying to call you since I'm not familiar with this, but
Oh, I got it. Share screen.
okay. I mean, I see you. Matt's joined. Okay, I got in and he just asked me. Yeah, so Matt's on, I saw that, and a couple other people. Okay, perfect, thanks. Okay, bye. Okay, bye.
Tell me when to start. Hey, Matt.
Hey, Dr. DeSilva. I think it's 2 o'clock. I think you're probably good to go.
So just start?
Yeah, Janet, are we good to start?
Yeah, I think so. It's 2 o'clock, so I would start.
All righty.
Okay, you're all set.
Here we go. Well, good afternoon, everybody. Thank you very much for joining me. My name is Dr. Derrick DeSilva. I am an internist. And as you can see here, I'm on the teaching faculty at JFK Medical Center in Edison, New Jersey. And I'm on the senior associate staff at Raritan Bay Medical Center in Perth, Amboy, New Jersey. I've been doing integrative medicine for the past 33, 34 years. So it's not something that I started last week. And, and I'm something that I'm truly enjoy doing. What I'd like to begin with is the concept of wellness. Wellness is not taking a bunch of vitamins, going to the gym once in a while and saying, well, I'm on a gluten-free diet. That's not wellness. Wellness is the idea of conscious eating, whether you're doing intermittent fasting, whether you're doing whatever diet you choose. And I particularly like intermittent fasting is really the way to go. Hormonal balance, I think, is really critical. Bioidentical hormones, vitamins, nutrients, supplements, absolutely key. Our foods don't have the nutrients and supplements that they did 80 years ago from the 1930s. And I don't have the word exercise up there. I have the word movement. Get up and do something. Get off your you-know-what and get out and do something that you enjoy. Because if you enjoy it, you're going to continue to do it. Mindfulness, one good deed a day. These are my 5 points of wellness. Why do I tell people to do one good deed a day? Because it boosts your immune system and it costs you nothing. I lecture and I take care of the professional drivers at the Mercedes-Benz AMG Driving Academy. And for me, the body, the human body is just an amazing machine that nobody will ever be able to duplicate. And I tell the drivers, look, guys and gals, what you need to do is you need to put the right fuels in, and you really need to take care of this machine in order for it to do what it's supposed to do. So our topic today is the endocannabinoid system. Everybody is starting to think that CBD, THC, yeah, a bunch of hippies used it in the 60s and 70s. Not true. This was first farmed about 12,000 years ago, and it was been used medicinally for about 6,000 years. Shen Yun made the first known medical recommendation for cannabis. And this was about 2737 before BC. So this is a long time ago. But here's something that's extremely important. What's the difference between CBD and THC? Well, let's use hemp and let's use marijuana. No psychoactive effect with CBD. With THC, there is a psychoactive effect. This is a very, very important distinction. In order for us to sell full spectrum hemp oil, and we should not be using the words CBD, we should be using the nomenclature full spectrum hemp oil, because CBD is a drug. And I will get into this in a little bit more as we go through this. In order for us to sell CBD, it has to be less than 0.3% delta 9 THC. All right. So less than 0.3% THC, we are able to sell it in the doctor's offices, in any place that you will see this around, whether it be a store or whatever. So let's talk a little bit about the endocannabinoid system. Just a little bit of nomenclature here. The body's primary tool for maintaining homeostasis or balance. Balance is what this is all about. And what this full spectrum hemp oil does is that it balances our system. It is the largest neurotransmitter system in our body. It is present in all vertebrates. So how do we get through this, and how do we make sure that we're talking about the right stuff here? The plant was first named cannabis. Its compounds were named cannabinoids, and the places they work within the body are called the cannabinoid receptors. Our body endogenously produces cannabinoids, and we'll talk about that in just one second. The plant compounds that are produced are things like CBD and THC. Remember, only nature does it perfectly. We try and we get very close, but only nature does it perfectly. So there are certain receptors within the body. They're called CB1 and CB2 receptors. And there are others which we'll talk about also shortly. But what our body produces are endocannabinoids. The body meaning endogenously produced cannabinoids, which are anandamide and 2-AG. And these receptors interact with other receptors, that the vanilloid receptors, the serotonin receptors, the adenosine receptors. And there are some enzymes that break down anandamide and 2-AG, which are produced in the body. So as we age, as we get older, what our body doesn't make, what our body doesn't produce, we don't produce enough anandamide and 2-AG, and this is where the supplementation comes in. So the CB1 receptors are found mostly in the brain, and the CB2 receptors are found more immune system, if you will. So the CB2 receptors are mostly found within the immune system, and the CB1 receptors within the brain. So this is why people say, well, how can this one botanical have so many different applications? Folks, it's because there are so many receptors within the body. So as a result, when you use full spectrum hemp oil, what's going to happen is that you're going to have interaction with these systemic receptors that are throughout the body. So CB1 receptors, brain, spinal cord, connective tissue, reproductive organs, glands, internal organs. As you can see, the CB2 receptors are mostly immune system: spleen, tonsils, thymus, white blood cells, T cells, B cells, macrophages, etc. As I said before, there are other receptors that work within the endocannabinoid system, and they're called the GPR receptors. Again, don't need to go much detail. Pretty much what you need to know is right here. CB1 receptors work in the brain and the spinal cord, and also some other organs, CB2 mainly within the immune system. So the endocannabinoid system, this is what our body produces. Our body produces anandamide and 2-AG. So what do they do? Let's talk about anandamide first. First discovered in 1992, and this is very recent, folks. This is extremely recent. It comes from the Sanskrit word, which is ananda, or bliss or happiness. It has a very short half-life. And anandamide, again, this is our endogenous production of endocannabinoids, which is anandamide, mostly act on the CB1 receptors. Where are the CB1 receptors? Brain and spinal cord. Not much on the CB2 receptors. And it's broken down very, very quickly. So what are some of the functions of anandamide? It is what gives you our sensation of pleasure, of happiness, of euphoria. We use full spectrum hemp oil to cope with stress, to help with anxiety, to help you relax. And there are many deficiencies of anandamide or the anandamide-like substances that have been linked to anxiety and levels of stress. And again, most of the slides from now on are going to be referenced. Anandamide's other functions, it's necessary for learning. It's necessary to transfer items from short-term memory to long-term memory. So if you're studying for an exam, and if you're going to be taking a test, it is extremely important that you have enough endocannabinoids, your body's production of endocannabinoids. So doing and pulling all-nighters, not a good idea, really not a good idea at all, because your brain does not store that memory. If you're studying all day and you don't sleep, your body cannot imprint what you've learned, right? So again, a very important function here for energy intake, for appetite, energy storage. And it also has to do with part of it, not all of it, has to do with that runner's high that we feel. Anandamide also balances other hormones. It's released during ovulation. It enhances libido. And the highest level of anandamide are found in the uterus and not in the brain. It is critically important for the implantation of embryos. It is a full agonist. This is, again, I'm sorry, we're now going to move into 2-AG. Remember, there are two endocannabinoids that are produced endogenously within our body, anandamide and 2-AG. So 2-AG is 200 times more than anandamide in their body, and it's a full agonist for both CB1 and CB2 receptors. But the main activity is for CB2 receptors. So inflammation, and so I'm going to show you data, by the way, on a product called Med7. This is not an infomercial, folks. What this is to show you data, that there is data on particular products and substances that are out there. 2-AG regulates immune function, suppresses inflammation. It is neuroprotective, and it's released when tissues are injured, regulates energy balance. So what happens here? One of the things, and one of the doctors, and I don't want to mention his name, but that I've worked with, his son plays football at a very high level. What he told me one day was, he said, Derrick, you know what I do? I give my son full spectrum hemp oil before a football game. He's a running back. He's always getting hit, and he's always leading with his helmet. So there's this constant jarring. And what happens is that not only does it and will it help with suppressing the inflammatory response, but there's a lot of tissue injury. And what he always used to tell me was, whenever he uses this, he's able to function the next day. And he doesn't get these concussions and all of the other stuff, unfortunately, that happens out there. It suppresses seizures, and we'll get into this a little bit more, regulates the vascular system, has an effect on blood pressure. And again, I will show you more data on this in just a little bit. And it also regulates communication from the gut flora to the brain. Remember that the brain is called the gut is called the second brain. So it has what is called a paracrine effect. What is a paracrine effect? A paracrine effect is when cells that are of different types that are nearby are able to communicate with each other. So 2-AG and full spectrum hemp oil in general has a paracrine effect and will allow these cells to communicate with each other. There's a gentleman by the name of Dr. Ethan Russo. This gentleman, this gentleman is once again, name is Dr. Ethan Russo. He's a neurologist, and he describes fibromyalgia, irritable bowel syndrome, treatment-resistant depression and anxiety, and migraine headaches as an endocannabinoid deficiency. That's a very, very dramatic statement for such a reputable neurologist to make. Fibromyalgia, irritable bowel syndrome, treatment-resistant depression and anxiety, and migraine headaches, he calls an endocannabinoid deficient system. Now, in my practice, as I said, I'm an internist, I'm an internal medicine physician for almost 34 years. In my practice, I use a lot of supplements. I use a lot of nutrients. I use a lot of management when it comes to lifestyle. I do a lot of BHRT, bioidentical hormones. I do peptides. But also within my practice, we have acupuncture, we do meditation, there's hypnosis, there's Reiki, there's aromatherapy. All of these pieces fall together. So if we have somebody with IBS, well, yes, we can use probiotics, we can use omega-3s, but what about relaxation, diet changes, etc.? You got migraine headaches. There are all kinds of things that we can do. So what are some of the clinical applications of full spectrum hemp oil? And folks, this is where the fun begins. I have in all the time that I've been doing this, I have never seen anything that has so many, one botanical that has so many applications. A botanical, talking about a plant. Now, there are things like coenzyme Q10, probiotics, omega-3s that have numerous applications. But as far as a botanical goes, as far as a plant goes, there aren't many that have this many applications. You know, something like ginkgo, for example. Ginkgo's wonderful, but ginkgo has applications with memory, focus. It has applications in diabetes, dilating the small blood vessels. So all kinds of good stuff. But when it comes to full spectrum hemp oil, I've never seen anything like this. It's incredible. So some of the proven benefits, and I'm going to go over some of this with you when it comes to Med7, which is one of the products that I've had the pleasure of working with for quite some time. So proven benefits in my practice, in my medical practice, somebody comes in with pain, anxiety, and they have trouble sleeping. Well, we've got to find out the causes, right? What are the causes? But in the meantime, we can get you on full spectrum hemp oil, because my top 3 indications for the use of full spectrum hemp oil, and I'll say CBD, but the right nomenclature is full spectrum hemp oil, are pain, anxiety, and sleep. Also, appetite suppression, movement disorders, things like Parkinson's. Parkinson's is a biggie. I have quite a few patients that have Parkinson's disease, and I could do a whole presentation on how to treat Parkinson's disease just very, very simply. Memory, seizures. We'll talk about a drug that's been approved by the FDA for intractable seizures in children. ADD, ADHD, brain injuries. Lots of applications for full spectrum hemp oil or things like Med7. And I'm going to get into the blood pressure things in a little bit to show you a little bit more. But It also has antiemetic, anticonvulsant activity. It has antipsychotropic. It has anti-inflammatory effects. Not only does it work on COX-2, so it's a COX-2 inhibitor, it is also a lipooxygenase 5 inhibitor. So not only do we get rid of pain and inflammation, we get rid of pain, but we get rid of pain, but we also get rid of inflammation. These two pathways must work together. There's another substance that has similar activity of COX-2 and LOX5, and that's turmeric or curcumin. It is an antioxidant. It has antidepressant, anti-anxiolytic, and anti-tumoral effects also. So where does it work? It works on the vanilloid receptors for pain modulation, on the adenosine receptors to help with sleep, and I'm going to show you data on all of this, by the way, and serotonin receptors for mood and stress management. And by the way, where is the greatest concentration of serotonin and dopamine produced in the body? I know that there's quite a few of you on here, and I know I can't hear you, but you need to know this.
In the gut.
Very good. In the gut. Absolutely. This is not made in your brain. And I'm glad that we're able to interact here. So you're able to talk back to me if I ask a question. Is that true? Yes?
Yes.
Good. Just one person. You're the only one that can say yes. Is that correct? Yes, that's all right.
If you unmute yourself.
Oh, you would have to unmute yourself. Okay. So keep yourself muted unless you have to say something in case you have a dog barking in the background or something. But anyway, this is what CBD does. And, when I first looked at this, when we did our first study with Med7, I said to the CEO of the company, Matt Smith, I said, Matt, we're going to be looking at all of these inflammatory receptors, IL-6, TNF alpha, all the interleukins. And I said, we need to look at the world of blood sugar and diabetes. Why would you think that there is an effect on diabetes? How would full spectrum hemp oil work? Why would it work in somebody that's a diabetic? Can anybody tell me? What would be the reasoning and the rationale? Anybody? Well, what happens here, and this is the theory that I had, and why I said to Mr. Smith to, check a hemoglobin A1C, because in my mind, there's an inflammatory response that happens within the pancreas. And the pancreas are not able to make and produce what it's supposed to do. So the beta cells are inflamed, and as a result, can't do what they're supposed to do. So we tested it and we looked at it, and I'll show you the data in a little bit. The effect on cancer, it has an apoptotic effect. So it helps with apoptosis, so getting rid of the bad cells so that these cells don't become senescent. We don't want cells to be senescent. We don't want cells to sit around, because if they sit around, they stagnate, and that's when the problems of cancer and all of the other diseases begin. If they sit around and they're senescent, or they're not doing anything, then they will produce all kinds of problems. So what CBD does is that it allows these cells to do what they're supposed to do. Nicotine addiction, drug addiction, neuropathic pain, osteoporosis, various pediatric conditions, and we'll talk about this, also motor disorders. We talked a little bit about Parkinson's, etc. So as I said before, we cannot be using this and calling this full CBD. No, because CBD is a drug. CBD is a drug. There's two drugs called Epidiolex and Sativex. Epidiolex was a drug, and both of these drugs, by the way, were sent through the FDA by a company by the name of GW Pharma. Epidiolex is for children that have intractable seizures. Sativex is for neurodegenerative diseases, specifically the spasms that people get with multiple sclerosis. So, two good drugs, but folks, I'll tell you, and again, we'll talk about this a little bit more. In my mind, unless you're using the entire plant the way God intended it to be, you will not have the effect that you should have with any botanical. You cannot pull out pieces of a plant or a fruit and expect that it's going to do what it's supposed to do. I've never agreed with that, and I'm not going to start with full spectrum hemp oil. You have to use the plant as God intended it, which is the entire plant, and stop pulling out pieces. Because once you start pulling out pieces, yes, they become drugs. And when they become drugs, when you pull things out, this is where the side effects and the issues begin. Panic disorders, OCD, social phobias, etc., etc., etc. There are all kinds of powerful anti-anxiolytic properties here that full spectrum hemp oil will do. And I use this slide all the time because I do a lot of age management medicine. It is a great 7 ways that CBD or full spectrum hemp oil combats aging. It's a great antioxidant. It protects your brain. It improves your memory. It's better than a chill pill. It improves your sleep. It is wonderful for your skin because it reduces inflammation and improves the quality of your life. What else do you want, people? Here it is. Why aren't you using this? I use it. I use it every night for sleep. I have never had trouble sleeping. But I'll tell you what, since I've been using this, the quality of my sleep has improved. And guess what? We proved that too. So, as I said before, we recommend the whole plant because there's something called the entourage effect. There are things called terpenes, cannabinoids. There's all of the endocannabinoids, CBD, CBG, CBC, other cannabinoids, terpenes, and flavonoids, and more. When you start pulling this one piece out, you're not going to have this full effect. People are now pulling out CBG and saying, oh, we can use this as an anti-inflammatory. Big mistake. Big mistake. I totally disagree with that. I want to use the entire plant. So let's back up one and let's talk about this. What are terpenes? Terpenes are the things that give plants a particular smell. Roses, right? You come into a rose bush or where there are roses, you can smell them. What you're doing is you're smelling the terpenes. These are a critical part. And if somebody's smoking THC, you smell it. What you're doing is you're smelling the terpenes that are burning, and that's the odor that's produced. So if you take out, for example, just the CBD or the CBG, and you try to let's say you want to try to smoke it, you're not going to get that smell because the terpenes are not there. And this is why this whole thing becomes extremely important. Our body produces endocannabinoids. Your hemp plant contains phytocannabinoids. It is really a superfood. Full spectrum hemp oil is really a superfood. Linoleic acid, alpha linoleic acid, other key omega fatty acids. It has adaptogenic activity. What is an adaptogen? An adaptogen is a botanical that has 3 particular properties. Number 1, they're fast acting. Number 2, they're non-toxic. And number 3, they balance your body. They put your body into homeostasis. So this is why people say, well, I use it to go to sleep. What happens if I take it during the day because I have pain? It's not a problem because your body knows how to adapt to what you're putting into it. If it's daytime and the sun's out and your cortisol levels are elevated, you're not going to go to sleep. But at night, if it's dark, melatonin's starting to go up, cortisol is starting to come down, and you introduce this before you go to sleep, yes, you're going to go to sleep because it balances your system. It contains vitamin A, B1, B2, B3, B6, B12, vitamin C, vitamin E, folic acid, magnesium, potassium, iron, et cetera, et cetera, et cetera. These are just some of the things that we have isolated from this plant. But look at this. Look at what CBD does. Look at all the things that CBD does. But look at what the other endocannabinoids also do. All of this working together is really what we want. This is what we really want in our system. This is how we want our system to work together in one piece. So let's talk about the data that we have on this product called Med7. And again, folks, please understand that this is not an infomercial, all right? It isn't. I've done infomercials. I've done a lot of infomercials. This is not an infomercial. This is a clinical presentation to a group of professionals. 7 clinical trials completed on safety, efficacy, and bioavailability on Med7. And you can read this. The first study had to do, supported by an NIH grant, inflammatory markers, anxiety, sleep, and metabolic A1C and homocysteine levels. I hope all of you know what homocysteine is. Somebody tell me what homocysteine is. Please. Nobody knows what homocysteine is. Unmute yourself and tell me what homocysteine is. If nobody knows what homocysteine is, I am going to be very sad. Google it, look it up. Hurry up. Okay, we'll come back. When you're ready, just jump in and tell me what it is, even though I'm talking. No problem. Number 2, NIH-supported A1C study on diabetes, weight management, blood pressure control. The 3rd study had to do with COVID. The 4th study had to do with sleep, awake time, O2 saturation.
Amino acid.
Go ahead.
Also an inflammatory marker. Amino acid and an inflammatory marker.
Did you know that or did you look it up?
I knew that. Come on now. Come on.
Well,
Plus,
you
I looked
didn't
it up.
talk to me fast enough. Come on.
Well, it's all socially awkward. It's weird. It's hard. It's a reach out for me, but I'm
Okay.
there for you.
No, but seriously, thank you. I appreciate you sharing that.
You got it.
So homocysteine is an amino acid. You're right. A lot of times this marker will be elevated if you've got a break in MTHFR. So if you've got a methylation defect, a lot of people that have either a COMT break or an MTHFR break, and they're not using the right B6, B12, and folic acid, right? So you should be using methylated B12, methylated folate, and make sure you also add the B6 in there. Homocysteine is a very, very dangerous amino acid that the way it works and it produces disease, and specifically cardiovascular disease, increases your risk for heart attack and stroke. And also what it does is if you have elevated homocysteine levels, the chances of you developing neuropsychiatric or neuro inflammatory diseases like Alzheimer's, dementia, etc., is extremely high. So knowing your methylation pathways, knowing whether you are MTHFR positive, whether you're heterozygous or homozygous, is important. Knowing whether you have a COMT break, again, is extremely important. So that's a different presentation, but we wanted to show you the effect that Med7 had on homocysteine and hemoglobin A1C. It also regulates cortisol because it has to do with stress. pharmacokinetic studies on the onset of action and bioavailability. Folks, if this doesn't get into your system, what good is it, right? It has to get into your system in order for it to do what it needs to do. And I'm going to come back to this because this is all broken down more. So let's get into some of the data. A1C reduction in 90 days. Day 0, hemoglobin A1C 5.2. No, this is not high by any stretch of the imagination. And this is an average, right? 5.2, that's actually really good. My hemoglobin A1C is around, varies between 5.2 and 5.4. But in 90 days, it dropped to 4.7. So what's happening here is the A1C coming down is also going to reduce your insulin levels. So what do you think is going to happen if you reduce insulin? Can anybody tell me, besides the one gentleman that's been answering all the questions? What happens if you start to reduce insulin levels when it comes to your weight and the way you feel? Anybody?
You experience weight loss.
Exactly. Exactly. You will not lose weight if you have elevated insulin levels. You won't. Why? Why? For the young lady that answered that question. Why will you not lose weight if your insulin levels are elevated? What do you think? Well,
Metabolically, your body has a difficult time releasing that.
yeah, exactly. Exactly. Insulin is a lipogenic substance. If your insulin levels are elevated, you cannot and will not lose weight. So 5.2 A1C, your insulin levels are not elevated. But if you drop down to 4.7, there's a direct relationship between A1C and insulin levels. As those levels come down, insulin levels, as A1C comes down, insulin comes down. You're going to lose weight. And guess what? We proved that and we showed that. What about when it comes to anxiety reduction? Look at this. Look at this anxiety. Remember we said it works on certain receptors within the body, the CB1 receptors. Well, here's proof that this natural product, and this is something called Med7, and Hempzorb is the compound, if you will, we studied. Day 0, anxiety reduction, and on day 60, look at the difference. Look at the p-value. Look at this difference in here. From 2.0, from 5.0, excuse me, it dropped to 2.0, and this is in 60 days. Now, I see this reduction very quickly. Doesn't take 60 days in my practice, but again, you have to make sure that the person is metabolically stable. You have to make sure that their vitamin D levels are normal. You have to give them some omega-3s. You have to give them a good probiotic. These are all things that you have to do together. And you, as a group that see these patients, you have to put the picture together. And that's why this is so critical. What about inflammatory markers? TNF alpha. Day 0, 6.52. Day 60, 3.14. Folks, this is a p-value of 0.03. That's incredible. What about IL-6? Again, another inflammatory marker. Day 0, 2.67. Day 60, 1.68. This is a huge drop. What about its effect on HDL and LDL? How many things that you know of are you a bit available to give a patient to increase their HDL? There's very little, right? Because everybody is lazy and nobody exercises. That's number one. That'll increase your HDL. What else? Somebody said something? Okay. So exercise will raise your HDL. If you smoke, you're out of your mind. I'm sorry. If you smoke, you're totally out of your mind. But if you stop smoking, your HDL will go up. The omega-3s,
Alcohol makes it go up.
why does alcohol make it go up?
I don't know. I just know.
Well, the reason alcohol makes it go up, well, alcohol doesn't really make it go up that much, but there's a very small effect. The problem is with alcohol, you may have a very slight bump in your HDL, but what else goes up? Your LDL goes up, your triglycerides go up, your insulin goes up, and your sugar goes up. So it's kind of a double-edged sword. You have to be very careful when it comes to alcohol, exactly how much you drink.
Niacin will bring it up too.
Niacin will bring it up exactly, because what it will do is will make those cells fluffier. Niacin has a small effect on the HDL, but what it has a greater effect on is making those teeny little bad LDL particles, making them fluffy. Because when it makes those particles fluffy, the liver is now able to absorb them and get rid of them. So the mechanism of action of the way niacin works is yes, it has a small effect on HDL, but a greater effect on LDL by making the teeny little dangerous LDL particles big fluffy particles, and now the liver is able to if you will, scoop them up and get rid of them. All right, but that's the mechanism of action of LDL. LDL also, if we're looking at this, day 0 effects of LDL, and on day 60, look at this, from little over 200 to 201, dropping it down to a little over 198. That's a big drop in 60 days. That's a substantial drop. C-reactive protein, another inflammatory marker. Med7, look at the difference look at placebo and look at Med7, what it did. You can see the drop here, p-value of 0.02. Look at homocysteine, placebo, and Med7. Look at the drop in those levels. And folks, if anybody's running around with a homocysteine level that's 22, 23, you are in big, big trouble. Your homocysteine level should be between 5 and 8. American Heart Association says you can have a homocysteine level up to 15. I totally disagree. What you need to do is, if you're looking at homocysteine, your level should be between 5 and 8. But again, you can see the difference here. NIH supported study on type 2 diabetes. Check this out, A1Cs. Placebo. No real change here. Look at the Med7 product. 6.84 down to 5.67. That's phenomenal. And this is in 180 days. Why did we wait 180 days here? Because we wanted to wait a little bit longer. The red blood cell lives 120 days, and we wanted to look at this a little bit longer to give it some time to really take effect. You can see the difference between the two. This is a huge difference. Weight loss, remember we talked about this, right? Your hemoglobin A1C is coming down. As a result, your insulin levels are coming down, and you're going to lose weight. 186 pounds, this is, how many days is this, Matt? 180 days also. So this, the hemoglobin A1C was correlated with this, with the weight loss. And you can see it's a 10-pound, a little bit less than a 10-pound, a little bit more, excuse me, than a 10-pound weight loss here. Girth, reduction in girth in the abdominal area, 44.8 to 41.08. Again, it's a couple of inches. I mean, that's a belt loop size, right? 3.73 inches average girth reduction in the Med7 group. That's a lot. Reduction in blood pressure, systolic blood pressure, that is. A 10 millimeter reduction in systolic blood pressure, as you can see here. Why? I think what's happening here is that people are getting more relaxed. It has a calming effect. It has an effect that people are just getting more relaxed and they're getting much more calm. This is some data. This is some data on absorption, bioavailability, delivery. Really hits peak at about 30 to 45 minutes after you take the product. This is more data on sleep. And again, 92 minutes change from placebo in deep sleep to the Med7 group. So they really got into deep sleep. And a 14-minute change from placebo to time to sleep, the time to get to sleep. So it was quicker. And also the deep sleep was longer. Heart rate reduction, again, helping reduce and calm and just calm the body. As a result, your heart rate is going to come down. This is interesting data from a group of patients, and as Matt Smith explained this to me, he was telling me that this all started about a year ago, and in the middle of it was the COVID epidemic or pandemic. And what we started to see was, let's look at these patients. And again, look at what happened. Inflammatory markers, the changes, placebo, Med7. Look at the changes when it came to improvement of these markers. And folks, with COVID, there's a significant inflammatory process that's going on. If we can slow down and suppress that inflammation a little bit, I think that these patients are going to do extremely well. IL-6 levels also came down week 1, week 2, and week 3. IL-6 levels came down week 1, week 2, week 3. And it was a graduated, if you will, decrease. Homocysteine levels, again, in these COVID patients came down. I'm not surprised by this because we have other data. I'm more surprised by this, on how quickly they came down. This I'm not surprised with at all. And this I'm not surprised with because it goes back to these two slides. If there's inflammation that's coming down, C-reactive protein is also going to come down. White blood cell counts also increase, and that was a good thing because the body's now able to fight infection. We have grass statin, generally regarded as safe. This is a very safe product. It's a novel food in the EU. And that's, once again, full spectrum hemp oil. And that's what this is. This is a certificate of analysis. And you can see the full spectrum hemp oil has more fatty acids than most omega-3s. Most omega-3s have about 4 to 6 fatty acids. You can see 8 different fatty acids in this certificate of analysis. And that ends my presentation. I always end my presentations with this slide. I was trained by the Franciscans. And for me, folks, this is a way of life. This needs to be a way of life. This is not a prayer. This, for me, the Franciscan Peace Prayer is a way of life. I thank you for your attention. I'll take some questions if you have them. And God bless you all. And good luck in your work as you continue to heal people every single day.
Dr. DeSilva,
Yes, sir.
do you have 1 or 2 recommendations for medical reference books to help us integrate more of the types of things you mentioned here?
You know, as far as books go, there's so much on the internet. You know, a lot of times if I need any new data or new information, I really just go to PubMed. The other thing I would suggest you do is attend conferences. I used to chair an organization called AMMG, the Age Management Medicine Group. In fact, we have an on-site conference next week in Miami at the Doral Country Club. For those of you that I will be there, Matt will be there, our entire team will be there. I'm actually doing 2 presentations there on epigenetics and nutrigenomics, and the other presentation is on natural aromatase inhibitors. So attend the conferences. agemed.org is the website. And, you know, as far as books go, I'm sorry, I've got a whole library of stuff, but Stephen Sinatra has some great stuff. Dr. Hyman has some great stuff. So that's what I would recommend.
Thank you. One more last quick question. Copaiba has been purported to have similar effects. Have you done any, could you comment on that if it works similarly in the endocannabinoid system?
Well, that's interesting because echinacea, green tea, cocoa, they all have effects on the endocannabinoid system, but they don't all have activity on CB1, CB2, and GRP receptors. So for example, echinacea has an effect. Where do you think it would have an effect on the receptors? Which one, CB1 or CB2?
The one with the immune system, is that
Exactly. So that's CB2, right? Whereas something like cocoa, chocolate, has a euphoric effect. And where do you think that would work? Which receptor?
CB1?
CB1. The thing is that all of these other botanicals have endocannabinoid-like activity on CB1 or CB2. But, and again, this is not a blanket statement, but the full spectrum hemp oil has effect on all of the receptors, CB1, CB2, GRP receptors, et cetera, et cetera. So you see the difference between the two is what I'm saying.
Sure, thank you.
You're welcome. Otras preguntas, por favor.
Dr. DeSilva, there was one question that came in on the chat, and it was, I'll read it to you. How would you respond to the notion if it's too good to be true, then it probably is, when talking about full spectrum hemp?
Well, I explained that already. I said that right in the beginning. The reason too good to be true is part of this is because when you look at the broad activity of this botanical, we have endocannabinoid receptors on every single cell in our body, whether it be your brain, whether it be the nervous system, whether it be the immune system, whether it be the cardiovascular system, we have receptors everywhere. As a result, when these receptors are so ubiquitous, this is where the effect from helping support the health of your immune system to stress and anxiety and sleep comes in. You have to look at the biochemistry of where and how these work. And this is why this is so incredible.
Thank you, Dr. Silva. I think we're probably out of time. You can always be reached for more questions. You can funnel them through us or go directly to Dr. DeSilva. But I know that they have another meeting starting really soon. So
no problem. To all of you, thank you very much. It's a pleasure to join you. And I thank you for spending some time with us today. Have a wonderful day. Blessings to all.
Thank you.
Thank you.